Today I'm going to be talking about the Imaging Record Quality Policy Development Toolkit. Before I get into how to use it, I'd like to talk a little bit about what is an Imaging Record Quality Policy. This is essentially a policy that an organization or consortium will put in place to ensure a standard definition of what a complete and consistent medical record is, specifically for imaging. The intent is to ensure that any records that might be managed and accessible meet those criteria, and anything that does not meet those criteria would be deemed non-compliant and would be subject to some corrective action or even rejection if the non-compliance could be considered a safety issue. Within an organization, there are a variety of different systems and departmental staffs and procedures that generate these images. These systems and procedures would be subject to being compliant with this policy to ensure that all the data that they're producing and making available through the enterprise is compliant. And this could result in, if there is non-compliance, some system updates or configuration changes, additional training or procedure definition changes through workflow changes, or even a removal of a system if it is generating unsafe data. Essentially, the intent of this is, if you think about the standard by which EMRs hold clinical data that is being sent into it, such as results, it will validate the messages coming in and not accept them if they are not compliant within a certain tolerance of expected values and format. Generally in imaging, we've not been held ourselves to that same level of rigor. As long as the data came in and it was displayable and the RADs weren't complaining and the report was generated, we were okay. But now, in the era of shared enterprises, we need to think about all that data being shared from all the constituents, including through systems like an enterprise viewer in the EMR. So you have not just dozens or hundreds of people viewing these images, you have thousands or tens of thousands. And that visibility and transparency, it's very important that we understand all of our work product is to a certain standard. So if we consider today's era of consolidated enterprises with the mergers and acquisitions and affiliation, a lot of data is being commingled. And each facility often has its own practices and standards, how they code things, how they identify things. And many of those have been around for a long time, a dozen years. And some of that data from the early days, where devices weren't as informatics compliant, may be incomplete. And some of those departments may not even provide the complete record. So how do we go about, first of all, defining what do we consider correct in this era? The purpose of this Imaging Record Quality Policy Development Toolkit is to provide a set of materials to an informaticist and some defined steps to help you determine within your organization, within your system, and how you're using that imaging data and your workflow and access policies, how to go about establishing what your organization considers complete and consistent. This is produced, it's by my company. It's available for a no-cost download at the URL there, which I'll repeat later. And you can find it just by going to dondennison.com and browsing for it under the Tools menu. Let's talk a little bit about how to go about defining it and then how to use it. So the definition, which is what the toolkit really covers, we're going to focus on today, is the first step in a kind of a three-step process, and I'll discuss the other two steps later. But let's get into exactly how to use this toolkit. So first of all, at the URL that was provided, you'll find a few deliverables that are free for download. One is these slides in a PDF format, so you can read this offline. The other is the actual toolkit, development toolkit itself, which is an Excel spreadsheet, and I'll show some screen captures of it and how to use it in the coming slides. And this essentially talks about or contains a set of default values that allow you to adapt it to your own organization's needs and policies and standards. And that data then, it's kind of like, think of it like a workbook. The output of that can then be pulled out or copied out and simply pasted into the third piece of the materials, which is a document template, which includes a preamble, structured subsections where you can put this content in, and allows you to then use that document as your actual policy document, which can be then made available to all your stakeholders within your organization and maintained there. So it's really a three-step process with an optional fourth step that I'll walk you through. One is to define the actual DOCOM attributes that are required and the type of value that goes within those that you're going to use to consider a complete imaging record. then you're going to take those values and put them into the document template, and you're going to basically fill in what it's required, why is it required, and you can add some additional context to it. And I'm going to show you examples of that. So it's pretty straightforward. You open the document template, you open the toolkit, and go to the tab that contains the DICOM attributes, and you will see that there's a number of rows organized into levels, so patient level, study level, series level, etc. And these are DICOM defined attributes, color coded for your reading ease. And you'll see in the columns we've provided a number of descriptions and tags and the value representation. Also the source, which means the value that's contained within there. What is the system that is providing that? Is it the EMR, so it's coming through an ADT message? Is it being mapped in from an order information, possibly populated through a DICOM modality work list? Is this something that the DICOM modality the modality workstation itself is entering, the tech? And then there's a status, and this is kind of a default value. So there'll be some stuff that is normally considered required and some others that you might normally consider optional. And this is really the work that you're doing, is determining what is required and what is optional. So as you go through that process, you'll see at the bottom there we cite, there's a couple of columns. One is it says, why is it important? And this is just some guidance to help you understand what is that value used for, and why should you consider it as potentially required or not, or optional or conditional within your policy. And then some typical rules. What are the type of values beyond just complying with the DICOM value representation for length or types of characters? What are some of the rules that organizations will often apply to that? And then you can use the typical spreadsheet filter to filter down to just the required attributes. So when you start this process, you'll see there are actually a number of potential candidates for inclusion in your policy that are listed there as either required or optional. But when you filter it down to the required attributes, typically it's quite a reasonable list for you to manage. So then you basically copy, as shown here, the DICOM attributes and the tags out of there, paste them into the Word document template, and then use that kind of rationale you use to determine its status, whether it was required or not, and what is required about the content within that attribute, and you document that in the requirement. You can add some additional notes that may be important for the reader of your policy to understand, and then there's also a section there you can apply a reference if you want to, if you use some type of external technical guidance to come to your conclusion as to why it's a policy or where you derived your opinion. So as you fill in those, you can fill in those columns, as I said. It might be a simple policy, just saying the attribute can't have a null value. So in other words, it can't be blank. The attribute might be there, but not blank, so it has to be some kind of value. Or it may have to adhere to some specific coded set. So if you have a defined set of procedure codes, it must be from our master procedure code table in order to be considered consistent. And you can add, as I mentioned, a note or reference. And you'll find the typical rules column here provides guidance in helping you define that requirement. Optionally, there's a section in the document that's provided, the template, as a section near the end that allows you to just document what are the patient identities that are in use within your organization in terms of the domains you're managing. So you may have, say, 7 or 8 facilities each, which either historically or on an ongoing basis are generating patient IDs, and this allows you just as a table to map those out. So what is the EMR? What is the assigning authority value? What is an example of the patient ID format? Is it 6 characters, 8 characters? Is it prefix, not prefix? And then within imaging, what is that being mapped to, which is not always a one-to-one mapping. You may find that the assigning authority is actually being coerced somehow into the issuer patient ID, or within imaging at that facility, the issuer of patient ID is not being used. So this allows you to just kind of create a master table for convenience of how patient IDs are being managed. So some advice if you're going to go through this process is be pragmatic. Start with something that's achievable. Don't try to go through and pick some of the DICOM attributes and you say, oh, they'd be really cool to use these things, but if it's not generally supported by a majority of your imaging systems, it may be very difficult to comply. In a policy where all your records are non-compliant, it doesn't have much value. So start practically and then look at changes to achieve a higher standard and do an assessment to what it will take to do that, and make sure you have buy-in to do that. Be consistent. You'll find a lot of times you'll get data from different departments or different sites. To hold one center to a rigorous standard, but allow all the rest of them to, or some of them to, contribute data to a central image management system, and not enforce that, or go to them and try to correct that, is going to end up, you're going to end up with a repository full of very inconsistent data, and then you're not really going to get the benefits of this type of record quality policy. And it's highly recommended you seek some form of endorsement from senior leadership. There's a lot of people who will, typically when you engage them on this type of program, and initially won't always see the merit of it because it's not something their end users may be screaming about. But it's good to get buy-in from a senior leader like a CIO or CMIO. Certainly if you went to them and said, is it important we have consistent and clearly labeled and high quality data in our EMR, they would say yes. And if our imaging records are part of that EMR, certainly it can be agreed upon that we should have high quality in the imaging records as well, because they're being accessed by such a broad set of people, and including up to patients. So it's usually not that hard but to get their buy-in, but it's important that you present them with some form of structure that says, this is what I mean by quality, so that you get some form of enforcement. So let's talk about, now that you've got this policy in force, you've got support for it, what do you do? Well, first thing is you have to assess your current data. So if you have millions of records, what percentage of those comply with each parts of your policy? Now, so you're going to need some tools and some effort, some skills on this, and sometimes it's the image manager, whether it's your PACS or VNA, can provide a user interface for this type of thing. Sometimes it may require a third-party tool, some form of scripting. The vendor may have tools that their support people can get access to generate that report. And when you pull that data out, you often want to make sure you don't just want to say X number of records are non-compliant. You really want to understand what part of that record is non-compliant. So this number of records are non-compliant because of this attribute contains a value which does not comply with your requirement, or contains characters, for example, that are not allowed by DICOM. So you want to know why that would be flagged as a non-compliant. And that will really give you a first pass understanding of how big of a liability do you have today in your current system, and allow you to judge how much effort will be to correct or get that up to your policy standards. It will also help you understand the source of a lot of these. Typically, the non-compliant records are coming from the same facility or the same system or same device, and this will be a first pass to identify who the culprits are that you probably need to go and do some corrective action on a system or training basis. So as I described, you can do that report. One of the kind of the higher level or better approaches is if you can actually put in force a set of tools on your image management systems that will, on a real-time basis, as data is coming in, being stored to it by modality, or say a PACS into a VNA, they can actually actively measure this and report on it. If that system, or if that process is too arduous and you can't do it real time, having some type of periodic assessment, like once a week, where you can say, okay, everything that came in the last week, this is my percentage, and you can chart that out. This could be quite an interesting analytics project for someone, an informaticist, to go and determine what are the causes of quality inconsistency, and how that's impacting your overall repository and your overall records. The other one is, so once now you've got an understanding of all this data coming in, and you're starting to apply, you understand the source of it and the cause of it and the non-compliance percentage, you want to start to apply it. You want to enforce that. So one thing is before you put a new imaging system, such as a modality or a mini PACS, or you're going to upgrade your PACS or any of those things, you want to basically look at their DICOM conformance statement and discuss that as part of the procurement process with the vendor. Use your policy as kind of a requirements input to that process. So essentially, before that system gets in place, understand, is that system going to be able to provide the level of consistency and quality you're looking for according to your policy. If you have an imaging source system already in place, at say a community hospital facility that's sending in data, it's often required or recommended that rather than shoving a piece of paper under their nose and saying, hey, here's our rules, is to reach out to that group and say, hey, we are now sharing data. You're going to be pulling data back from us, and you're sending data in to us. We've gone to the effort of defining what we deem as a definition of a clear and consistent record, and we would like to sit down and talk to you about your system and your acquisition processes and look at your records so that we can ensure we're on the same page. And this often can be then viewed as very positive. The system admin gets some understanding of these things, which they may not have had, and then they also understand the rationale behind why this is important, and understand the benefits of it. Uh, and then finally, when you have new facilities joining your enterprise, a hospital that's been purchased, an imaging set of imaging centers has been purchased, when that data is coming in, often the third party, if you're using a third party migration service, they will have tools to look at that data and inventory it and assess it before putting it into your image manager archive. And if you use your policy when you sit down with them and engage with them at their statement of work, you can then have that conversation saying, these are the things I'm interested in. I would like you to measure the data according to this, and then provide a report to see what corrections I can then judge what corrections I may need to do. It will also help me assess if there are records that are non-compliant, how many of those, if I have tools on my image manager to detect and segregate non-compliant data, it'll kind of help me understand what is the percentage of error rate I'm likely to get and how much manual correction am I going to have to do. And that's certainly going to affect or help you judge how much labor on your side you're going to have, and how much effort there is during the migration project, which will help you judge the timing, which is often something you need to report out as. And all that I just covered would also apply if you have an internal data migration team with their own set of tools. They can also use this policy as input to their work planning. So that's about it. You can see the URL there to get the tools, and there's a landing page which will provide a little more details, and I'll keep that updated. You're free to download this and use this. If you have any feedback, any questions, any suggestions, any comments, I'm welcome to those. Please contact me through any of the contact information that's there, and I'd be happy to continually to improve this or add additional information if you've got some ideas. So I hope you find it useful, and good luck in defining quality within your organization and hopefully raising the bar for imaging records everywhere. Thank you.